Today, we're exploring the radius. The radius is the lateral bone of the forearm, lies parallel to the ulna, enabling smooth forearm movement. The radius, like all other long bones, is divided into three parts: the upper end, the shaft, and the lower end. The upper end of the radius articulates with the capitulum of the humerus at the elbow joint and with the ulna at the proximal radio-ulnar joint. Now, let's have a closer look at the key anatomical features at its upper end. The head of the radius is disc-shaped and articulates with the capitulum of the humerus, enabling rotatory movements. The neck is the constricted part located just below the head, connecting it to the shaft. The radial tuberosity lies below and medial to the neck, serving as the attachment point for the tendon of biceps. The shaft of the radius is convex laterally, widens distally, and is triangular in shape, featuring 3 borders and 3 surfaces. The 3 borders of the radius are: anterior border extends from below the radial tuberosity to the styloid process. Its medial border is the sharpest border, serving as the attachment for the interosseous membrane. And the posterior border is smooth and well-defined only in the middle third of the shaft. The radius has got 3 surfaces on its shaft. The anterior surface lies between the anterior and medial borders and contains the nutrient foramen. The posterior surface is located between the posterior and medial borders. The lateral surface is positioned between the anterior and posterior borders of the radius. The lower end of the radius is the widest part of the bone and has 5 distinct surfaces. The anterior surface of the lower end of the radius is smooth and faces forward. The lateral surface features the styloid process, an elongated projection on the outer side. The posterior surface contains Lister's tubercle, a palpable dorsal prominence. The medial surface has the ulnar notch, where the head of the ulna attaches. The inferior surface forms part of the wrist joint, articulating with the scaphoid and lunate bones. There are several key muscles, has its origins and insertions on the radius. Let's look at them one by one. The biceps brachii attaches to the radial tuberosity, aiding in forearm flexion and supination. The brachioradialis inserts on the distal radius near the styloid process, assisting in elbow flexion. The pronator teres attaches to the middle of the radius, helping in forearm pronation. The pronator quadratus inserts into anterior surface of the distal radius, also assisting in pronation of the forearm. The supinator attaches to the proximal radius, facilitating supination of the forearm when the elbow is extended. The abductor pollicis longus originates from the posterior surface of the radius, aiding in thumb abduction. The extensor pollicis brevis muscle originates just distal to it, on the posterior surface of the radius, aiding in thumb extension. The flexor pollicis longus originates from the anterior surface of the radius, flexing the thumb. The radius ossifies through 1 primary center and 2 secondary centers. The primary ossification center for the radius appears in the shaft during the 8th week of intrauterine life. The secondary ossification center for the lower end develops at the 1st year and fuses by the 20th year. The secondary ossification center for the upper end appears at the 5th year and fuses by the 12th year. To determine the side of the radius, hold the bone with the head facing upward. Sharpest of all borders, the medial border facing medially, and the radial styloid process positioned laterally. So can you guess the side of this bone? Correct. This is the right radius. Let's now talk some clinical aspects on the fractures of the radius. Colles' fracture is the most common wrist fracture, typically occurring in elderly females who fall onto an outstretched hand. It involves a complete fracture of the distal radius, with the distal fragment displaced dorsally and angulated. The displaced fracture segment causes the characteristic dinner fork deformity as shown in the image. A radial head fracture accounts for 20% of acute elbow injuries, often caused by falling on an outstretched hand, such as in sports or bicycle accidents, and can be associated with elbow dislocations. A chauffeur's fracture is a fracture of the radial styloid process, typically caused by sports injuries or falls. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more anatomy insights. See you in the next video.